A lot of our patients have more than one condition, so they have heart failure and many other comorbidities, which can definitely be overwhelming. When you have a comorbidity, it means that you have more than one medical condition at the same time. It is very common for a heart failure patient to have multiple comorbidities, including diabetes, chronic kidney disease, lung disease, atrial fibrillation. So the heart and the kidneys are connected in a very complicated way. You almost can't have one functioning well without the other, and vice versa. So for example, if your heart isn't pumping well, your kidneys may be backed up with blood or may not be getting enough blood supply. And vice versa, if the kidneys aren't working well, it sometimes causes the heart to have to work harder to pump. Heart failure and diabetes are also very interconnected. So for example, if a patient has diabetes and they have poor sugar control, that can affect the heart pumping function and can also actually affect the heart cells themselves. It's very hard to control heart failure if we don't also control a person's other comorbidities. For example, if diabetes is out of control or lung disease is poorly controlled, then it's much harder for the medications for heart failure to work the way they're supposed to work. So we have to make sure that we're treating everything at the same time and getting everything to function well. So sticking to your heart failure medications can also help your other organs, and many of the newer medications that we use for heart failure can actually also help the kidneys, for example. I would say that it's really important to let your doctor know if you're overwhelmed, because we are trained to figure out what to do to handle all of those conditions at the same time. There is a healthcare team always available to help. The doctor, the nurses, the social workers, and all of us can work together to help your medications work for you.